Okay, good morning, everyone. Okay, my name is Liu Xiangming. Today, we are going to present about the challenge for the providing the self-care. First of all, in 2019, around the 198,000 active dentists and the dental expert USA has been temporarily suspended due to the outbreak of COVID-19. This virus has been easily spread during the dental procedure. This virus is respiratory illness, which primarily affect the respiratory tract and is believed to be transmitted through the aerosol and formalin. Breathing and talking will produce the droplets, which is aerosolized and can be easily transported in the air. These particles stay suspended in the air for a longer period of time. This virus has been transmitted through the use of dental intervention and they are close to the mouth and throat. Next, I'm going to talking about the challenge for providing the self-care in dentistry. First of all, the first challenge we have is a risk of the infection transmitted in the dental facilities. During the dental procedure, the using of the ultrasonic instrument and the high-speed handpiece is very common. However, this instrument will produce the aerosolized from the oral secretion, such as the saliva and the blood into the surrounding. Due to this procedure, it will generate a large number of the aerosol and droplets, which we usually will standardize the protective measure provided by the dental care worker, and is not enough to prevent the spread of COVID-19, especially when the patient is symptom-free and aware about the disease status or falsifying the infection's history. Therefore, the containment of the propagation of the virus would be nearly impossible. The second challenge we have here are social and family impact. The dental practitioner and they are willing to enter this professional has implicitly agreed to accept the risk. However, they need to balance their obligation as professional with their duty to their family also. The risk to the personal health from the COVID-19 is high, but the risk of infecting their family because of exposure on the job is unjustified and not acceptable. Practitioners have been facing a sort of ostracism by society. Several operators have been asked to vacate their rental accommodation as they may carry the virus and spread to their family members. Then the third challenge that we have is a psychological impact. Due to the discontinuation of the routine dental practice, it causes a severe psychological setback. In the normal situation, dentists will have the longer working time, dealing with the multiple patients and taking the difficult and complex decision, formulating the treatment plan and performing the exhaustive treatment procedure and professionalism. However, during this pandemic, majority of the citizens are remain isolated, and dentists has spending hours without being productive, which establish a sense of hollowness and anxiety in their attitude, fear of losing job, backup, and fear of the getting infected. This additional stressor during the pandemic, which coping with the depression, may cultivate suicidal tendencies and psychological issues. Next, we have the training and education issue. Because due to the pandemic, it has exposed the potential gaps that exist in the public health emergency response in most countries. This will be the wake-up call for the dentists to prepare for the pandemic. For example, the dental health professionals have undergone a lot of training in the medical subject during their education lives. They have been trained to perform an emergency procedure, prescribing the medication, taking the oral swab, and administration of the anesthesia. This skill will make them vital candidates for the supporting national health service during this pandemic. Here are some examples which the dentist can participate in. For example, the patient surveillance refer to the physicians and diagnosis on the basis of the intraoral examination and collection of the oral and nasal swab, monitoring of their infection and recovery status, conducting the immunization program for the patient, and prescribing the medication. And the last one will be the ensuring the maximum infection control in the hospital.
The next challenge is the financial impact. Dental community is going to be affected as a result of a sudden break in the dental practice for many DHB. Setting up, running, and sustaining a dental practice itself is already an intensive task. Therefore, in the absence of the support from the government or other authorities, many DHB are facing a financial problem, such as the cost of PPE, the decrease in the number of the patients to the clinic, the expiry of the dental materials, and the staff worker salary and the shop rentals. Larger organizations and universities with multiple DHB will also be affected because of the several fixed expenses such as the staff pays, rents, taxes, loan installment, dental materials, and equipment supplier. The next challenge is the shortage of PPE, which is personal protective equipment. The requirement of PPE has increased as a result of the rapid spike of COVID-19 across the globe. This situation has created a temporary shortage of PPE in many countries. The lack of PPE has put the healthcare workers, including the dental practitioner, in the high risk of exposure to the virus. A decline in the supply of healthcare due to worker illness and the demand for care will cause the healthcare infrastructure to become unstable, thus reducing the quality and the quantity of the care available. Besides, sick healthcare worker also can contribute to the virus transmission. The next challenge is the need for reconfiguring the dental practice. Due to the COVID-19 pandemic, routine delivery of non-emergent care has been suspended to minimize the transmission of the disease. To safeguard the patient health during the care, update recommendation for communication protocols and physical measures must be in place. This can be achieved by conducting the pre-appointment screening through email, text, phone call to ensure the patient with COVID-19 symptom or the patient that has close contact to the COVID positive patient do not travel to the dental office. Besides, it also can be achieved by expanding the registration process to screen out the patient with COVID-19 symptom or the patient that has close contact with the COVID positive patient. The patient are required to use the face mask properly, and also the dentist can also check the patient temperature with a thermometer during the registration process. The dentist can also have real-time video consultation to determine whether the patient oral health condition require urgent dental care or not. Some dentists also set up telehealth service as an adjunct to face-to-face appointment for such circumstances. Such as platform enable dentists to evaluate the patient oral condition and develop the treatment plans based on the data collected from the patient. The last challenge is the delayed dental care. Delayed dental treatment can be caused by the reluctance of the patient to seek care during the pandemic and can be caused due to the closure of the dental clinic. And unemployment can also cause the loss of employer-sponsored dental insurance coverage. Therefore, patients could be expected to experience progressive dental disease if denied the dental care needed or it delay for a substantial period of time. Untreated dental caries can further progress into irreversible pulpitis, which further complicate the dental procedure.
Okay, so next we are going to discuss about how to overcome these challenges. So the first one is implementing infection control and prevention in dental office. So dental health practitioner need to follow standard contact airborne precaution, including hand hygiene practice. We can also limit the number of dental healthcare provider, and only the essential individuals are allowed to be present during the procedure. Visitors should also be limited to the people who are necessary to support the patient's care. Also, the patient can consider taking extraoral radiograph instead of intraoral to avoid gap reflex. And the office should be disinfected with EPA approved chemical and maintain a dry environment. The next one is that the dentist use a dental handpiece with anti-retraction function, four-handed dentistry, high evacuation suction, and rubber dams to minimize droplet splatter and aerosol generation. Next is minimize the use of ultrasonic instrument, high-speed handpiece, and three-way syringes. The next one is to perform endodontic procedure with dilute solution of sodium hypochlorite to extend supplies without adverse effect on outcome. Next, we can use resorbable suture to eliminate the need for a follow-up appointment. Next, the dentist should wear a N95 or medical face mask, eye protection, glove, and gown. And the dentist should also perform procedure in a negative pressure room if possible for aerosol generating dental procedure. Next, we can place a portable HEPA air filtration unit within vicinity of the patient chair while the patient is undergoing a potentially aerosol generating procedure. The next step is stress management. The Center of Disease Control and Prevention has also suggested several ways to cope up with stress, such as taking break from acquiring pandemic news, practicing meditation, eating healthy, exercising routinely, talking to people, and avoiding consumption of alcohol and smoking. They also have introduced hotline number to contact in case someone feels overwhelmed, depressed, anxious, or have suicidal feeling. As a conclusion, COVID-19 pandemic has made a strong, unavoidable impression on dentistry and poses many challenging situations to achieve efficient patient and DHP protection. It is important that the dental institution must focus on developing pandemic management skills in the future DHP, so that they are ready to deal with the adverse situation themselves while also supporting their fellow medical professionals. That's all from us. Thank you very much.